if I'm not wrong, it was it was quoting the chaos of digital health in sub-Saharan Africa. And indeed, it's been a chaos. I mean, for over 10 years now, you have quite a number of digital health tools that are coming into the country, being implemented in project style and project clauses. The digital health tool also sort of clauses. There's no continuity, there is no sustainability. So that has sort of created the chaos. And I think that article really, really explained the chaos that is happening in sub-Saharan Africa. But I think much of the problem has been attributed to, to the lack of strategies. Most countries, and not just in Africa, even outside Africa, had not had strategies of digital health developed and even implemented. So it became difficult to guide the implementation of these tools. It became difficult to guide the design of these tools. It became really difficult to guide even their interoperability at various levels. So because of the lack of guidelines, everyone was implementing the way they felt they should implement without any guidance. And the major challenge that we have faced right now, and specifically for Uganda, is that most of our health workers are not of the current generation. They're like, say, maybe 35 and above. And at the time when they went through school, when they went through the lower level education, the upper level education, college and universities, there were no computers, probably. And even if they were there, they focused mainly on their technical areas, like the medical, the medical school, which was largely to do with the medical studies. And there's nothing like computers introduced. I think the introduction of computer courses has just started. And although it is being taught at the lower levels, when people go ahead into universities, they drop it. It's not like a mandatory course. They drop it. So you go through school, you go through university, and you don't even know how to use a computer. You don't even know how to switch on a computer. So during implementation of some of the digital health solutions in Uganda, there's quite a bit of resistance, which really hindered the progress of implementation. And it took quite some time to understand why. I mean, we had developed all these change management plans. We had carried out change management trainings, and, like, created change management champions, like, yeah, this is going to work. But it still wasn't working. It's still, the tools still weren't being adopted and being put to use. So I think for me, I'd had to take a back step and really understand why. Why are these health workers not using the system? We have trained them on how to use the system. We have trained change management champions. We have put everything in place. The computers are available, internet is available. Why aren't they using the system? So for us, our focus was, why are they not using the system? They should be using the system. So it took me a back step, and in one of the gatherings, just out of curiosity, I spoke to one of the hospital directors, like, hey, but doctor, we have trained, we have provided computers. I mean, we've been complaining that you don't have computers to use them. What is happening? It's like, Carol, you know what? Let me tell you the truth. Yes, we want to use the system. It could simplify our work, but my people don't know how to use computers. They cannot even switch on a computer. Some don't even know how a computer power button looks like. I'm like, oh yes, this is where the biggest challenge is. And for me, it was an eye-opener. I was actually really, really so happy that it was a problem that I discovered. Yes, it was a bit late into implementation, but I was glad it was discovered. And we really, really had to realign and go back and sit on the drawing table and, like, guys, look here. The people to who we are delivering these computers cannot switch them on. They will not tell if the network is off. They will not tell if the network cable has been plugged out. They don't even know how a network icon looks like. So I don't think we are doing it right. So this took us back and into redesigning a whole curriculum on training health workers in the basic ICT skills, creating a whole strategy around developing skills of health workers, the basic skills, the basic ICT skills. And we did it as a pilot, and I can assure you that the few facilities where we piloted it, it really worked magic. And they were so excited. They showed the hunger for using these digital tools, because now they were able to use computers. They were excited to use computers at their age. The excitement to use computers was so visible. And although the pace was quite slow, you could see that now they have opened up. They can use these, they can use the computers. They can sit on the computer and know how to navigate the internet. They know this is the web browser. I can access this here. I can open a document like this. I can prepare a PowerPoint presentation and present it after. For them, it was a plus, because you're looking at them. They've been doing their work manually. They've never used computers. You have these young doctors coming in. They know how to use computers. They're doing their work so well. And now for them, they felt like left behind. But now, bringing them up to speed with the basics in capacity of using a computer was really, really a big achievement. And the uptake was so good. The feedback was really good. And for me, I realized that actually this is a challenge that is cutting across, and not just in Africa, but in other areas, that as much as we are trying to push for implementation and adoption of digital health tools, our health workers, the last mile users, actually do not even have the basics of using a computer. And if that is not addressed, if that is not paid attention to, the paid attention to, there's been a whole coalition pushing for community health workers to be compensated, to be paid, and not let them work as volunteers. But I think there's need for a coalition to push for the health workers to be actually trained on how to not just use digital health tools, but how to use even the computers, how to identify a small problem and be able to troubleshoot it and continue working without disrupting their work. Because I mean, if I can't identify, if I can't even know that this is how a network cable looks like, this is where it goes for me to be able to access internet. I mean, when it goes out, I would say the system is off. As a health worker who has never seen computers, who has zero training in computers, I'll tell you that the system is off. It's the network, not the system. But it will all have to take a whole coalition and a movement, which I'm really willing to participate in, to advocate for actual training, actual capacity building of the health workers in the basics of the digital world, the basics of technology. Before now, we start pushing them into using these digital tools. I had an opportunity to visit Ethiopia last week, and it was a benchmarking visit. I visited Ethiopia with one of the Minister of Health officials from Uganda, and on a benchmarking visit. There's really quite a lot to learn. And I must tell you, I think I saw someone from Ethiopia here. I must tell you that Ethiopia is really, really a step ahead. They have a few challenges here and there, but they've really moved. And I think it is because they've been able to identify some of these challenges, some of these weaknesses, and have addressed them step by step. One of the things I learned from Ethiopia is that they have this whole information revolution agenda, which is not just tagged to health. It is tagged to other sectors within the government, and the leaders have aligned themselves with the information revolution. So it has started from the top, not from the bottom. And even if the leadership changes, the information revolution agenda stays, because it has been adopted by the government. So that is a governance issue. It has been adopted by the government. They have put strategies in place. They have put strategies in place to align partners, to align donors. But one thing that I have really appreciated from them is that this capacity building in digital health, they've taken it to another level. And for me, I usually call it a moving train. The train has different sections. If one section drops off, the train will stop, or it will crash. So this whole digital health implementation has to be a multi-sectoral. It has to take a multi-sectoral approach. The health sector cannot do it alone. Education sector has to be on board. Information technology has to be on board. The telecom companies, that is the private sector, has to be on board. The universities, the colleges have to be on board. It has to be a collaborative approach for it to move and achieve the agenda of digital health. This is how Ethiopia has done it. And for me, it was quite a big lesson to learn. They have the universities and colleges, they are colleges of health sciences, have adopted a curriculum which has been developed with support from our partners like JSI. Actually, it has been developed, and the tools which are being used within the health sector, the digital health tools that are being used within the health sector are in the curriculum, and the health workers are actually trained from college on how to use these tools. So some of these challenges, like not being able to use computers, are being identified at that stage and being addressed. So by the time a health worker comes out of university, they know how to use a computer, but they also know how to use the digital health tools that are being implemented in the facilities. And this is because they have a plan, a 10-year plan, and in that plan, they have identified the priority systems to implement within the 10 years. So the people they are pushing out from the colleges and universities, they have knowledge of those tools. They have been equipped with the capacity on how to use those digital health tools. So they're not coming in to learn, no. They are coming in now to do the work because they have already learned during medical school how to use computers, how to use the digital health tools that are in the facilities where they are going to work. And it is a curriculum that has been adopted across both in the private and the public sector in Ethiopia. The other thing I've learned from them is they've not just stopped at that. For the in-service, they also have a curriculum for the in-service, those who are already in service. And the program has been called the Continuous Professional Development. And these health workers within the facilities who are already there have been trained, and they are continuously trained on not just these digital health tools, but the required skills to use the digital health tools. And this, it is not being done by the Ministry of Health alone. It is being done by the Ministry of Health in collaboration with the education sector, through the colleges, through the universities, through other training institutions and learning institutions. They have also created online learning modules, and I think their online program is on the internet. They have created online learning approach where health workers are able to go in and like have these refresher trainings on a routine basis. And they have a tracking tool which tracks who has completed what course, who is at which level, and they keep, if a module is added onto the system, they upload it onto the system. If people are unable to grasp the basics of the module of the system online, they are able then to have another approach of teaching. It is sort of blended. It's not just online. It is blended. You have facilitators who come in once in a while to give these other trainings. So it is a collaboration. It is a train with all its cabins moving together, and not education here, education train here, health sector train here, ICT train here. It is one train moving in one direction with one common goal. So I think if our governments in Africa can adopt, it may not be the exact approach, but a similar approach of collaboratively working with all the stakeholders, with all the sectors. I think also now that most of the governments, most of the health sectors in governments in Africa have finalized development of the strategic documents. I think Malawi launched theirs, was it late last year? We have Uganda, which is launching next month. Ethiopia has theirs in place, which is yet to be also launched. But they have these other documents that have been put in place to guide implementation, and they have been endorsed and approved at a higher level by the ministers, by all these directors. And for me, I think if our governments put these policies in place, of course, slowly by slowly, we are moving, we are working, but we don't stop developing, we don't stop innovating. But if there are policies to guide how innovations are done, if there are policies to guide how digital health tools are designed, I mean, when you design a tool with a health worker, what challenges can you have? You cannot have so many challenges because, I mean, these are their workflows. They have guided you on how they perform their duties within their daily work in the hospitals, in the communities. They have told you, this is how I see my patients. This is what I assess on a daily basis. This is what I assess on a weekly basis. This is what, and the workflows have been tailored to their needs, the health worker needs, and not me sitting as a developer and like, no. I think in Uganda, they'll need this, it will work like this, it will work like this. No, sit with them and ask, can it work like this? Other than building tools to come and give them to use. Let our governments need to put policies in place that will allow developers, that will allow users of these digital health tools to participate in their design. Then we'll have no major challenges with the adoption of digital health tools, because you also will be excited to work with something that you have contributed to. And the digital health literacy will also be, it will be achieved if we take that direction. What else can I talk about? Talked about policies, I've talked about collaboration, I've talked about strategies and guidelines, I think, yeah. Over to you.
Wow, thank you so much for that enlightening session. Thank you so much for giving us that that piece from your experience. And I can really tell that implementing digital health strategies across Africa will actually help us to maximize the potentials of digital health interventions to solve healthcare problems. And you've touched on so many ideas. The first step, which you talked about, is to actually identify the gap and try to see strategies and implementations that you can do to fill that gap, which is trainings, coalitions, and integrating all sectors to come together to actually come up with a sustainable plan. Thank you so much for that insight. I don't know if we have questions for our speaker. You can please unmute your mic and ask your questions. Or you can raise your hand. Now.
Good morning.
Yeah, go ahead. Go ahead.
Good morning. I'd like to find out if you have access to resource that basically, from a research point of view, right, tracks digital health literacy across Africa, both in the workforce population and also in the general population as well. And then secondly, whether you'd be willing to participate maybe in a multi-country survey looking at that problem so that we have really like strategies among stakeholders. Thank you. Sorry, my name is Simpadanya. I'm calling from Nigeria.
Should I respond to that, or I wait for more questions?
No, you can go ahead and answer that.
All right, thank you. Daniel, thank you. That is if I got your name well. The small research that has been done was we conducted a nationwide capacity needs assessment at all levels, both from the very, very primary healthcare workers up to the national ones. And from this is where we're able to identify the actual gap. That was after I had a discussion with the director. And from that needs assessment, we were able to tell the cadres whose skills are really, really low, the cadres whose skills are intermediate, then those who have advanced skills. And from that needs assessment, you could tell that, for example, the nurses, the female nurses, the midwives actually, had like the most minimal skills in ICT. And I don't know if it's because the male gender is really, really inquisitive. They're always looking out there for things, for technology. I don't know if that is the case, but from our assessment, we determined that the female workers within the health facilities and at all levels had the most minimal skills in ICT. And this was just done in Uganda. I haven't done any other assessments out of Uganda, but I would really, really would love to participate in any in case there is. Thank you.
All right.
Just to follow up.
Okay.
Sorry, the tools that you use, is it possible that can it be shared? And hopefully, I mean, I'm interested in doing that study in Nigeria, for instance, and maybe a few other countries if we find partners. But I just want to know whether it's something, whether that tool is something you can share, and
Sure.
Okay.
We can discuss about that tool. Yeah.
Thank you very much.
Okay, so I can see collaborations are happening already. That's impressive. That's the way to go, right? Mompei, you can unmute your mic and ask your question.
Hi there. I don't know if I'm coming through. Can you hear me?
Yes, we can hear you.
Okay, great. Good morning, everyone. My name is Puselezo. I'm from a company called Sen Health Academy. And just on the point of research, we actually did a survey. It was around the beginning of the pandemic, and we surveyed healthcare professionals across the continent. So we actually got feedback from, I think there were about 13 countries, and it was around, just the technologies that people are interested in, because our background is that we're a technology company. So basically, we really just wanted to know, the technologies they're interested in, the technologies that they're working with. And from that survey, it actually, just what Carol was saying, it surfaced that people were saying that, look, we can't really be interested in technologies if we're not conversant with them, if the literacy is low. We actually have done some research around that. They did indicate that there was a lot of interest around things like AI, but obviously the feeling was that it's very, very far into the future because the basics are not there. And that is actually why we created our academy, which is basically around, the building of very basic introductory skills around technology and healthcare. So I just wanted to just illustrate that we have done a survey. The results, yes, are about, the name is Sen Health Academy. So it's Sen Health. I'm just seeing there from the chat box, somebody's asking their name. It's Sen Health Academy.
Maybe you can
so
into the chat session.
Yes, I'll type it into the chat box there. Yeah. So we launched it about, I want to say we're into about a year and a half ago. So we've had enrollments from around the continent as well. And oddly enough, from India as well, from Pakistan as well, which we really weren't expecting. So we've had healthcare professionals. And I think, to Carol's point again, a lot of our enrollments tend to be males, far more than females. And sometimes we suspect that maybe it's because, women are on the front line. They're the ones who are holding the hands of the patients. They're the ones who are doing the nuts and bolts sort of work. So maybe they don't have the time to necessarily, take time out of their working day to enroll in these courses. So we're also looking at ways of seeing how we can make the content maybe digestible in smaller chunks, just see how we can do that. So that's something we're working around. Sorry, I know I've said a lot. I don't know if it all made sense, if there are any questions, but I just wanted to chip in there and just say what we've been doing.
Okay, thank you so much for that input, and well done to everything you've done. So you can just type the name of the academy into the chat box so that people can go online and search it out. So thank you so much. Do we have more questions? Mompei, your hands are still up. Or do you want to put them down? You have more things to say? Okay. All right. So in the absence of any other question, we've come to the end of today's session. Make sure you check us out online, Digital Health Africa. We'll be hosting more of these webinars to facilitate conversations around promoting digital health agenda in Africa. And we have quite a lot of initiatives around that, as well as also working on digital health literacy in Africa. So we'll definitely be collaborating with everyone who is interested in doing that to ensure that we improve the digital health literacy in Africa. Thank you so much for joining the session. The recorded session will be sent to your mail, the mail you used to register for this webinar. So watch out for that. Thank you so much, everyone. Let's have a great day. Bye. Thank you so much, Carol, for coming on board. Thank you so much.
Thank you.
This was very informative.
Thank you for
you.
inviting me. Thank
And
you.
if you're interested in volunteering with us, please feel free to send us an email. We are doing a lot of things right now, launching our digital health student network very soon. This is also a way to improve digital health literacy by, fostering that knowledge even at the university level. So please, you can reach out to us to volunteer, to collaborate and partner. We are very, very much interested in that. All right, with that being said, we ended the session now. Enjoy the rest.
Thank you.
Yeah,
Have a
bye.
good day.